Welcome to the Group Social Welfare Policy Issue and Presidential Administration video in regards to child welfare policy from the Child Abuse Prevention and Treatment Act through the Adoption and Safe Families Act. This presentation is brought to you by Misty Parker, Cheyenne Mandel, and Heidi Decker. The Child Abuse and Prevention and Treatment Act, CAPTA, was enacted in 1974. The purpose of CAPTA was to provide financial assistance for demonstration programs for the prevention, identification, and treatment of child abuse and neglect, and to establish a national center on child abuse. The Adoption and Safe Families Act of 1997 was passed to increase rates of adoptions and other permanent placements for children in foster care. The history of child welfare in the United States can be characterized by a continuous thematic shift between family preservation and child safety. The 1970s saw a number of efforts to reduce children's time in foster care and expedite paths to permanency. The 1997 Adoption and Safe Families Act marked the first time issues related to permanency were explicitly stated in legislation, which was pivotal in changing the landscape of child welfare practice. CAPTA was enacted more than a decade after Dr. Ray Heffler and Dr. C. Henry Kempe drew public attention to the battered child syndrome. Both doctors practiced ethical obligations to their patients, whom were children. They were advocates to help increase the misdiagnosis of children to cover up child abuse. Social welfare advocacy at the macro level, it takes senators, legislators, congressmen for change to happen. Senator Walter Mondale was the author of the federal act, whose intention was for the act to address the problems of the most severely threatened and abused children in our country. While Senator Mondale was pivotal in authoring the Child Abuse Prevention and Treatment Act, as you can see, there have been several revisions and amendments over the years. Another social welfare reformer was President Bill Clinton. He was an advocate for adoption. He believed that every child up for adoption should have a loving family waiting for them, as his father passed away before he was born. President Bill Clinton signed the Adoption and Safe Families Act into law. He made November National Adoption Month. Along with his wife, they created public service announcements promoting adoptions, and he gave the directive to more quickly move children from foster care into permanent families. President Bill Clinton was a true advocate for adoption. Other elected officials that were advocates for children were Representative David Camp, who introduced the Adoption and Safe Families Act to the House on February 27, 1997, and Senator John H. Chafee, the AFSA lead sponsor. He said, "We will not continue the current system of always putting the needs and rights of biological parents first. It's time we recognize that some families simply cannot and should not be kept together." John Chafee still recognizes older youth aging out of foster care by observing grants funded in his name to assist them in continuing their education in college. The Adoption and Safe Families Act was enacted in 1997 in response to concerns that many children were remaining in foster care for long periods of time or experiencing multiple placements. This act clarifies reasonable efforts with emphasis on safety, allows concurrent planning, requires filing termination of parental rights, mandates states to find permanent homes for children, and gives preference to placements to relatives. As you can see, between 1974 and 1997, many notable events took place in relation to child abuse prevention and child abuse awareness. To point out a few, in 1983, the first Child Abuse Prevention Month proclamation was issued. In 1988, Ronald Reagan gave the first proclamation for National Foster Care Month. And in 1989, wearing a blue ribbon in the month of April drew awareness to National Child Abuse Prevention Month. Child Protective Services agencies were growing during this era. There was a lack of reporting child abuse and neglect by professionals. Foster children were drifting from foster home to foster home. Women's rights movements was intact. Women were fighting for higher wages and equal opportunities as men. The recession of 1982 occurred during this time period, as well as Ronald Reagan's welfare reform. Some of the biggest civil issues during this time period surrounded the drug epidemic. Legislation increased the penalties for nonviolent drug offenses in an effort to get drugs off the streets. As a result, the number of people incarcerated for drugs increased eightfold. Two movies in the media that addressed child abuse during the time of the Child Abuse Prevention and Treatment Act was Mommy Dearest and Firstborn. Both chronicle stories of child abuse and highlight the need for CAPTA. Here is a little clip of the movie Mommy Dearest.
Hey, Christina, get out of that bed. Get out of that bed. Go live in the most beautiful house in Brentwood and do not care from wild hangers. Your room looks like a $2 replaced room in some timid backstreet town.
From when the Child Abuse Prevention and Treatment Act was passed in 1974 to when the Safe Families Act of 1997, the United States experienced a lot of political and social change. According to the Georgia Council on Developmental Disabilities, the 1970s was a time for women's rights activism as well as a time to combat inequality rooted in past discrimination. During this time, Sandra Day O'Connor was nominated as the first female Supreme Court justice. Affirmative action groups were also implemented in the workplaces and colleges to increase the percentage of minority employees and students. 1974 was when the impeachment hearings against Richard Nixon began, leading to his resignation later in the year. Notable security threats or issues during this time were the Cold War, the Gulf War, and Timothy McVeigh's bombing in Oklahoma City. According to Jacobs, the Indian Child Welfare Act was passed in 1978 in attempts to bring Indian child welfare under the control of Indian nations. According to D'Amelio, the marches in 1979 and 1987 proved that a nationwide queer constituency had come into being. TANF was created by the Personal Responsibility and Work Opportunity Act instituted under President Bill Clinton in 1996. The act provides temporary financial assistance while aiming to get people off of that assistance primarily through employment. Currently, the Democrats control the House of Representatives and the Republicans control the Senate and the White House. From November 2016 until the election in November 2018, Republicans were in control of all three. The current president did not begin his career in politics until 2016 when he became the president. Prior to that, he primarily worked in real estate and entertainment. Due to his short length of time in politics, he does not have a substantial history of policy-based decisions to review. According to the WhiteHouse.gov website, the primary issues to be addressed at this time are education, national security and defense, budgeting and spending, immigration, and healthcare. With today's political climate and the inability for the opposing parties to find common ground, a change in this social issue is not likely unless it were an issue tied to the type of funding utilized to strengthen child welfare services. From 1974 to 1997, child welfare advocacy has made great strides, starting from the White House down. Child abuse was brought to the forefront by Henry Bergh in the early 1900s, where efforts were made to strengthen laws for children and their right to be free from abuse and neglect. Advocacy in the child welfare social issue arena has been key to bringing changes in favor of the child. Everyone is a mandated reporter of child abuse and neglect now. Funding is available to aid in services to families and children. Children have the right to have a loving and nurturing home through adoption if reunification efforts are not achieved. Laws have been passed to ensure that there are time frames for children that are in the child welfare system so that they can achieve permanency. Ensuring that doctors, social workers, and politicians continue to advocate for the nation's most vulnerable population through any political climate, civil unrest, or any other societal factor is paramount. As social workers, we need to continue to advocate to strengthen child welfare laws. Join us this April 5th in wearing blue to recognize Child Abuse Prevention Month.